happily, a number of these facilities have now been completed and are indeed in use, have been in use for some time.
It's too good, very, very good. The nurses here are caring, the doctors are very good, they are friendly, they are very, very good, and they give the best treatments. They are very good.
I really thank God that I'm able to make my state very proud, all right, and for the amazing recognition. It was an award of resilience, okay, about what it is that Bayelsa State does differently, you know, for us to have a low rate of transmission. In those days, the rate used to be very, very high, the prevalence used to be very, very high, but in recent times, it has reduced to like about 3.8, and it's even less for the transmission of mothers with HIV to their unborn babies. It's really, really reduced, and this clinic is doing that. Our job is to ensure that all babies born to HIV positive mothers come out negative.
The report of 9.1% came before the government took over. Immediately it took over, we sent in briefs from the Ministry of Health to him, and he saw that, you know, a lot of things were wrong with the health sector. He knew that our infrastructures were decaying. He knew that we did not have the right human personnel to manage the health sector. He knew a lot of things were wrong. We didn't have the right mix of the facilities. And immediately, you know, set up an agenda, and we started implementing the report. He set up a couple of committees that went into looking at what the problems were with the health sector, and we came up with solutions. I immediately implemented those reports, and that's where we are here today. You know, before it came, we had only about 8 hospitals that had capacity to manage issues around HIV/AIDS. But now, as I speak with you, we have over 250 facilities, health centers, hospitals, and tertiary hospitals that can conveniently and easily manage any issue that has to do with HIV and AIDS. And that is the basis of our improvement.
The main government house facility, which was within the main campus of the government house, was mostly for government dignitaries. However, the governor felt that the public should have access to better health care too, and decided to build a second portion of the hospital. And in addition to that, we now have up and coming a stroke center, a cardiovascular center, a heart and vascular center, which will house a stroke center, dialysis center, in addition to the cardiac center. So we are set, and it's going to be a transformative period because we're bringing new technologies to Bayelsa, and it will require a lot of hands-on additional training for some of our medical staff to ensure that we provide the best healthcare possible. We're set overall in terms of being ready to take on the challenges of healthcare improvement in Bayelsa.
I'm an operating room nurse in surgery, and I think that's very important that we have qualified surgeons, we have qualified staff, and we have the proper equipment to do the cases. And I think we can bring nurses in here to help, and I believe that we could take nurses with us and where they can see and train them also. I think it would be a great program. I have been training like supplies that they need in the OR, scrubbing procedures, certain standards that we go by, such as temperature and humidity, that we make our OR safe to use. So that would be my goal, to make them safe and to have the staff well trained. We need some donations, we need some help, and we need visits from other people to come and help us. But it's a wonderful place to be. The facilities, I think the facility is beautiful.
We need to get baseline knowledge of cardiovascular and stroke to the people, providers, and to the community. For the hospital itself, ease of or facilitation for the equipment, and the options that we can have to make this equipment available to more people and these techniques available to more people. And it involves basic life-saving procedures when a patient becomes pulseless or apneic, which they're not breathing, and methods to revive the patient's life status. So it's very exciting that this should happen, and we're just going to see how it goes.
Well, we have gone far with regards to infrastructural development. We are talking in this place, which is now the Bayelsa Specialist Hospital, which was formerly Government House Clinic, one bungalow here. We put it down and put up this one-story building, fantastic one, well equipped. From there, we decided that we should have another one outside here for the public to access this place because of the equipment here. So we had that one done, and then from there we progressed to the cardiac center that is being developed and being equipped. We've gone far with the equipment. We've also ensured that every local government headquarters has a referral center. So general hospitals are built in every local government, 5 to be specific, because the other 3 had existing hospitals that have been worked on to a very fairly good standard now. We have the diagnostic center also, which has been completed and functioning effectively, taking care of our patients and people from all over the country, from the north, south, the west, and even the east. Functioning optimally, very well. If you enter there, you will forget that you are in Nigeria. And then we now went into the health financing policy and brought up Bayelsa Health Insurance Scheme, which I am part.
Apart from putting down the infrastructure, apart from creating the environment to enable these facilities function, apart from the investments we continue to make, government will also use this opportunity to call on the private sector, or to use this opportunity to call on all our citizens and everybody residing in Bayelsa State to subscribe to this program, because this is a program initiated for your own benefit.
Most times when people are ill or they need care or they need the services, one of the things that actually deter them from coming to access those services is finance. So basically the scheme is all about protecting the people of the states. We also have the National Health Insurance Scheme. We talked about making sure that virtually every Nigerian is protected from that financial catastrophic cost, where people, part of pocket expenditure, you get to the hospital, you're sick, and they will say, why didn't you go to the hospital? Say, I didn't have money. They have not paid salary. So the scheme is all about making sure that the financial barrier is taken off, that people have access to a care that is not just ordinary, care that has quality. The aspect of quality is factored into this scheme, and that this scheme is accessible and then it's affordable. That's all that the scheme is all about. The whole world, everywhere, talked about the health insurance scheme. Luckily, here in Bayelsa State, we have been able to have that, the Bayelsa Health Insurance Scheme, which actually has a legal framework. And that law came into existence 2013, July. So the legal framework is already there. This present government, to make sure that that aspect of finance is no longer an issue, to make sure that everybody have access to care when they do need it, as much as we want a well population, that when people are ill, let money not be the issue. And I think that's where we are there.
Bayelsa Health Insurance Scheme is a social health financing model. Social in the sense that we do not stratify enrollees according to their medical risk or enrollees according to ability to pay, so to say, or desire to pay. Everybody is involved. Everybody pays according to how much is earning. And then everybody is brought into the same level. So we call it risk equalization. So everybody's risk is brought to the same level. And then there is major government contribution to it. So no matter how poor you are, as long as you are enrolled into the system or into the scheme, you will receive the same services as somebody that is paying much more. So that is the beauty of it.
There is no law barring the government from using a completed project without commissioning. Now, when you talk about the dividend of democracy, it means completing a project and putting it into use. So whether or not there is an official commissioning, the fact that that project had been delivered is highly commendable. And I'm sure there is no crime committed in the eyes of the law. Rather, I think applause should be given. However, in this part of the world that we live in, there is the need sometimes to pass this information because information is key. Some people may not know that these things are in existence. Now, if you do not commission them, if they do not see official commissioning to say this thing is due for use, there might be some skepticism surrounding it. Has this thing actually been completed? Is it actually in existence like they have said it is? So it is a thing of mindset and understanding, of course, levels of education. For certain persons that know that the place is already in use, of course they will go and use them. But for those that do not know that it's in use, they may not even have the access to even say that this place is in existence. I think, with due respect to the restoration government, that commissioning this project would help in sending the right signals to those that would use this project to say, hey, this thing is already in existence. They can even recommend it to some of their friends if they know that these things are in existence. So people need to use them only if they know. Now, when that knowledge is lacking, then it becomes a huge challenge. However, you cannot say that that is a blow against the government. A commission project that is put to use is a good thing for service delivery as far as governance is concerned?
Commissioning of projects alone is not supposed to be a problem. The most important thing is on completion of projects. And if projects have been completed, to me alone is just to put it into use. Not that commissioning is bad. The most important thing is, will the public benefit from this project? And if the public is to benefit from the project, then the project should be put into use.
It cannot be better than this. I'm not a politician, but what I'm telling you is the truth. You cannot quantify them. Is it education? Or where? Infrastructure building? Then coming down to health. Government has invested much on primary health, secondary, and tertiary.
Because the other stores around, you really can't tell where the drugs are coming from. You really can't tell. Because it's not as if there are regulatory bodies that look at where these drugs are being gotten from. But with the Bayelsa State Drug Distribution Center, with a pharmacist being in charge and knows all it takes about drugs, the safety and all of that of drugs, and then the storage conditions of drugs, because drugs that you see, if they are not stored in a proper condition, the safety is reduced, the potency of these drugs are reduced. So when you have a qualified person managing such, and then being able to distribute it to these various pharmacies and drug outlets out there, it makes it safe for patients to have the right drugs. I think the state government is trying to see how there will be a single channel of procurement of these drugs. And then if these drugs are gotten from the right source to the end users, then it's a good thing. Because right now we have all sorts of fake drugs around, and which the end user might not be able to know which one is fake and which one is not fake. So if we have a system to control all of that, it's a good thing.
If you are managing a health system, one very important aspect of a health system is drug distribution, availability of drugs. But as you know, you cannot completely manage. 80% of patients require drugs. They require drugs. So drugs are an essential aspect of the care of a patient. And if we have a system where drugs can be easily available to hospitals and patients at a cost that's affordable to them, and we can guarantee quality and safety, then whatever system can provide that, then it's a system that we should accept. And in fact, some patients have even died of drug reactions. That's the truth. So the drug mart offers the potential of reducing the cost of drugs, providing quality drugs, and making the prescription and utilization of drugs safe. That is the advantage of the drug mart.
When a fake drug is administered to a child or a patient, of course we all know the effect of using a fake drug. So if we have this center now, this center will be able to monitor the kind of drugs that come into the state, the kind of drugs that get into the hospitals for us to use. So when we have this, as a nurse, you can be rest assured that whatever medication you are using, as long as it is from that place, you'll be sure that it is authentic.
A very harmonious cooperating relationship with the Bayelsa state government, there is no element of friction whatsoever. Anytime we have needed their assistance and we go to them, they have always been there for us. And this project is one project we approached His Excellency, Right Honorable Henry Siraki Dixon, to help us to build our intern and resident quarters. And he graciously did that approval. And as I speak with you, right now we have a 60-bedded, fully equipped residents, doctors, and intern quarters at the extreme of the hospital. They don't really collaborate with their federal counterparts, but it's not the same in Bayelsa State. The Bayelsa State government have always collaborated with the Federal Medical Center. In fact, one of our newest coaster bus was given to us by His Excellency himself, and we are very grateful.
Every ward in this state should have a functional healthcare center that is staffed, resourced, together with accommodation facilities. But very often that's also a challenge for the medical staff. And even in this recession, the areas that we consider important, education, healthcare, expanding agriculture, investing in critical infrastructure, investing in security, we have not stopped doing that.